Welcome to episode 47 of America in Crisis, Breaking the Cycle of Addiction. My name is David Hunt, and I'm your host. Please set your DVRs to record. This show could save your child's life. Today's guest is Dr. Sun Fletcher. Recently, at Lumin Substance Community Meeting, I met Sherry Crowley, who is the Director and Clinical Outreach Provider, Concierge for Lumin Health, and I knew I just had to have them featured. Sherry introduced me to Dr. Sun Fletcher. Dr. Fletcher is a Harvard-trained, board-certified psychiatrist who practices in emotionally genuine and compassionate care to help patients develop and maintain stability in their long-term health. She is trained in ketamine-assisted psychotherapy, as well as MDMA-assisted psychotherapy through MAPS. She has particular interest in how psychedelic treatments can help treat some of the long-term sequelae and adverse childhoods, which can be notably challenging to treat. In addition, Dr. Fletcher specializes in infant attachment and mental health, with a primary focus on the lifelong consequences that can originate from disruptions in critical early relationships. Doctor, welcome to my show.
Thank you so much for having me, David.
It was a pleasure. I'm glad we finally got to catch up with each other.
Absolutely.
Okay, let's start by getting to know you. You're a doctor in what fields?
I am a doctor in psychiatry, which is the field of medicine that deals with mental health. And this is the area of medicine that involves all the things that affect our brains, our emotions, our thoughts, and behaviors.
Obviously, you're a doctor. What other qualifications do you have, and how long have you been doing this?
So I have a medical degree, and I have further specialization in psychiatry. I also did a fair amount of scientific research at the graduate and PhD levels. So it's been in school for a long time. I'm glad to be out in the community making a difference now.
Can you name some of the schools? Give them a free plug on TV.
I don't know how far back you want me to go.
Just a couple, just so we know your background.
Yes, so I went to Yale University for my undergraduate degree.
Oh, just Yale.
In biochemistry. And then I did my MD at Harvard. Yes.
Let's just say you assume you know what you're talking about.
I hope, Harvard, at least in this narrow instance, yes.
Harvard and Yale, did they like fight with each other?
I'm sorry?
Did Harvard and Yale fight with each other?
Yes, absolutely, but I have to say my blood runs blue, so.
I'm not going to ask you which one you like better.
Yeah.
Okay, now I understand you're also a teacher. Can you elaborate on that?
Yes, so at the sort of more advanced medical levels, that form of teacher is very fluid, because I think medicine is still sort of works in terms of like an apprenticeship. So as someone who's early on in training as a medical student, or what we call a resident, who is a fully qualified MD who is in the process of specialty training, they have a lot to learn, and they learn by doing and with the guidance of older practitioners and teachers, and so I am a teacher in that sense.
Now, Lumin is huge. Can you explain what your role itself is, what your function is?
Yes. So Lumin has currently 4 sites, which is so incredibly exciting. I am the site medical director, which means that I'm responsible for all of the clinical care, the safety, and the care and treatment of the patients on my site in Woburn.
Oh, so that's all.
No, it's I love taking care of patients. I ended up choosing to primarily be in medicine because I love working with folks so much.
Right. And how long have you been with Lumin doing this?
Yes, so since the clinic started in October, I joined the site full-time in November. So pretty early on since they started here.
So I earlier made the comment about this huge. I understand you have 5 facilities, including one right here in Woburn. Can you tell us where they are?
Yes. So the original site, the mothership, is in Newton. And the second site we opened, over a year and a half ago. That's in Cambridge in Harvard Square proper. And then there are the Woburn sites and the Brookline site.
Okay, describe what I would find in Lumin. We're going to throw a couple of pictures up on the screen of Lumin. We've got the waiting room, and of course we got the treatment room.
Yes.
What's in the, here they are now.
Oh, fantastic. Yes, so this is our daily.
Very nice. I see snacks.
There are so many snacks, and there's drinks, you know, the Spravato, which we'll talk a little bit about later. As it goes through the nose and down, it can be a little bit bitter, so we like to have all sorts of little things on hand, and also when people come on an empty stomach, it can make them a little bit nauseous.
I'm definitely going to have to visit you guys for an on-site inspection.
Please come on by. We have more snacks.
I don't know about the treatment room, but you can tell me the snack room.
Yes.
Okay, we got another picture coming up of
Fantastic.
the actual treatment room. What are these things? What is that white thing there?
This white thing?
No,
oh, this guy here. This is where some of the magic sauce is. There, we keep some of our medical equipment there where it's out of sight, out of eyes. There's some lighting. There's various lighting because we know that, you know, ketamine, Spravato, and similar psychedelic kinds of medications, it's very important the surroundings, what our senses are experiencing as we start the medication. And that's sort of the thought behind Lumin. We want it to be a safe, comforting environment where you have as much control as possible to make sure that you're in a good space when you're starting.
You've thought of everything. That's very comfortable.
It is very comfortable. So that's a recliner, so you can lie fairly flat back. It heats. There's a little bit of massage in there if you have aches and pains, which, you know, some of our patients with chronic depression have chronic pain as well, so we want them to be comfortable. So there's this dimmable light, there's this dimmable light. You can't see with this beautiful view, but the shades actually come down for full blackout as well. And we also give patients eye masks, so you can go as dark or as bright as you'd like.
You have thought of everything.
I hope we've thought about a lot of things, yeah.
Now, obviously you're not the only one there. You have a medical staff. What's the level of medical training that they've had?
Yes, so we have a variety of range of clinicians, all who are qualified in mental health work. We have our nurse practitioners who are advanced degree nurses who lead the day-to-day on the floor, and we also have nurses who can do treatments and injections, and we have social workers and mental health counselors who also help do treatments.
Now, it's fairly well known that before people seek actual professional treatment, they try to cover depression on their own. Yes. Why is reaching for alcohol not the best move?
I have so much to say on this.
Go right ahead.
So to start out, I like to think of depression as a message from our minds and our bodies that we need to take a break. It's sort of like a human version of hibernation. It's when our brains sense that we don't have enough resources, sort of emotional, social, physical resources, to live the lives that we would like while feeling safe and fulfilled. In depression, our brains can get stuck in this hibernation mode where you're just, you know, you're feeling down, you're having a lot of negative thoughts, and you don't want to do anything, and you're just like, what's the point? You feel hopeless. And when you get stuck in this place, it can be hard to come back out, even though the situation might have improved. And that's emotionally really difficult. And there's various ways that people deal with this emotional difficulty. And as a psychiatrist and as a doctor, I think the best way is to use medicine and therapy, and together there's a lot of evidence that says it helps the brain come out of this state. But you know, it's easier for people to access alcohol and other drugs, and I can sort of explain what that does by sort of giving you an example.
Go ahead.
Yeah, so let's say you're gardening because it's spring, and you get this big splinter in your finger. Let's say the splinter is depression and the finger is your brain. Okay. you think, oh my goodness, the splinter, it's too painful to pull out. It's too much work to pull out. No one can help me pull this out. So instead of pulling the splinter out, putting some medication, antibiotics on it, wrapping it up and letting it heal, you say, I'm going to take alcohol because when I drink enough, I won't feel the pain of this splinter. The alcohol helps you feel better for the moment. It helps you not feel that pain, but it actually isn't fixing the splinter at all. In fact, the splinter's there, it's causing sort of infection, it's probably getting worse. And that's sort of what alcohol is like in treating depression. Yeah.
Almost like the hypothermia deal. Oh, whiskey makes me warm up. I can go outside in the cold and I don't feel that I've been shoveling for 8 hours with wet feet. I don't feel I'll take another shot of whiskey. No, you're freezing to death. You're getting frostbite. You just don't feel it.
Yeah.
It covers it up and masks the problem.
Yes.
Which is why you want to turn to a professional.
Yes, and it can be really hard to get that help, and that's part of the depression. It makes us not want to do anything, and we feel stuck. We just feel like doing the easiest, most accessible thing. But that's when it's really important to reach out for help.
Even when people think about it, you need that cattle prod. I'm going to see a professional, I'm going to see a professional. Then the next day, nah, just take my beer. That'll make me feel good. It's getting the person into the facility or to make the phone call. And that's so hard to do.
Yes.
I mean, I have a medical issue, and getting me to make the phone call is like plenty of, like, no, not another week at Winchester, please, I'm not going to call.
Oh
It's going to go away on its own, don't worry. Doesn't matter, I'm turning the color of a Smurf, it'll go away. So you've got to go to the professionals. Just waiting on your own, or I'll cover it up, or I'll take a hit of oxygen, that'll be fine. It'll be all over in the morning. Yeah, it could be, but not the way you want.
Absolutely.
A big question for you. Now that cannabis is legal, can't they just reach for a joint and say, oh, that cures everything, that gets rid of my stress, that gets rid of my pain, that's my excuse for getting high. Oops. Was that out loud on TV?
I wish that were the case as well. So what I can say is that cannabis is also a type of chemical that suppresses and depresses our brains, just like alcohol.
Yes.
So alcohol and cannabis, they're both what are called depressive substances, and they just slow everything in your brain down. And while it can make things feel temporarily better, it eventually, actually, with long-term exposure, it can get your brain stuck in that depressive place. So it can lead actually to depression and anxiety over the long term. I also want to mention cannabis specifically in young people, particularly young men.
Please do.
You know, if you have, and you won't, and you know, especially the young men that this affects, they won't know this until this happens to them. It can really trigger any underlying vulnerabilities or likelihood that you might develop psychosis. So I know young men who are living their lives, they start smoking in high school and college, and they, you know, next thing they know, they're admitted to an inpatient unit, and they're on these really powerful antipsychotic meds for the rest of their lives. And it's very sad to see.
The other thing is, unfortunately, people that start out with a joint or a little bit of marijuana, and they're not removing the stressor itself.
Yes.
It's still there, like, okay, hey, this worked for a couple of months.
Yes.
What's going on? It's not working anymore. I think I'll take an extra one. I'll do an extra joint the night before bed. And then they get used to that.
Yes.
Then the body's saying, okay, you still have the stresses. You need a professional to help you get along. There are other methods, and this is why you have these guests on the show. And for people that have been out there and said, oh, I tried therapy, or I tried going away to detox for a couple of months or a week, or whatever, it didn't work. There are so many alternatives. And a little later in the show, we're going to get into one of the newest groundbreaking treatments that are out there. People are going to look and say, what? But I looked at it and said, am I reading that right? And they, yes. So if one thing doesn't work for you, even within the same facility, there are other doctors, there are other treatments available. So what I'm saying is, don't give up. There are other things available. If you didn't like building A, go to building B. We've had about 20 people on our show And what Son's about to say is going to be groundbreaking. It took me a few months to get her in here. One, she's a doctor, and number two, I had my own little health crisis. So I'm so happy to have her here today. Now back to the good questions.
Okay.
A lot of people are trying heroin and other hard drugs for depression. How can your services help these people that are now hooked on heroin, that are now worried about fentanyl getting in the mix, and God forbid xylazine?
I know, it's xylazine is such a scourge. So, I would say the first thing you want to do, especially if you are on any of these medications, is that as you come off, it's going to be very uncomfortable, especially with all of these depressant medications, alcohol, cannabis. Cannabis,
Yep.
Just to do last touch, people don't think there's a withdrawal from cannabis. There's actually a weeks to months long withdrawal from cannabis, which causes depression, anxiety, and insomnia. So I just wanted to put that plug in there. If you are on any of these opioids medications, you want to seek the help of a professional, MD, nurse practitioners, some kind of mental health clinician who can help you come off in a safe way. And some people, they have their, receptors for these medications in their brains have reset such that they might need medical help or medications to help them maintain their mental health in a safe way. So I would do that, and then thinking about treatment, potentially with us to, again, get at the underlying problem.
I know it gets difficult for people because he's a construction worker. He gets hurt at work. He's out 90 days. They give him an opioid. Now, he's not getting high from it. The dose the doctors give you are not going to get you high. They're just going to stop the pain and get you through the day. The problem is 90 days runs out. Now your body says, hey, I need that. Different things happen that they got used to. And now without it, cold turkey, there's no titration or lowering the dose. It just cuts you off. So well, I know what to do. My neighbor's a drug dealer. I can get in there drugs from my neighbor. I'll get heroin. I don't know what's in it, what's been mixed with it, how they got it, but it sounds good. I need to get back on an opioid, which is absolutely the wrong way of doing. The man's not trying to get high. He's trying to get through day by day, not nauseous, not vomiting, not wanting to get off the bed, and all he's trying to do is find it. And that's why it's so important, again, to call someone like Son and say, hey, I was on an opioid legally. I'm off of it. I can't function. What can you do for me? And this is why I have her here today.
Yeah.
So,
if I can give you an example, maybe some of your viewers work out and they sort of, build their bodies, their muscles. Imagine you are a cyclist and you cycle, and you're used to all of a sudden doing an e-bike. And then you do that for 3 months, like you said, and then you all of a sudden then try to go back to a normal bike. Your muscles have deconditioned. You've gotten used to having that battery help you, and then trying to do normal cycling after that it feels impossible. It's sort of a similar situation with
let me ask a quick question.
Yes.
No drugs involved, just anxiety. People are stressed nowadays. I just filled up my truck for $122. That's anxiety.
Yes. Yes.
Going through a medical crisis, that's anxiety. Is that something you can help me with, or do I need to be alcohol or drug dependent for you to help me?
Yes. So anxiety is absolutely something that psychiatrists and therapists and mental health professionals can help with. Anxiety is sort of a warning system for our bodies, our brains saying something is wrong, you gotta fix it. And that's why it's so uncomfortable. And the way that we can improve anxiety and treat anxiety is to figure out what is driving that anxiety. Is it sort of the state of the world? Is it parts from our past that make us feel like the world overall is an unsafe place? And then understanding that, then we can use medications. Antidepressants are actually have really great evidence, sometimes even better long-term evidence for treatment of anxiety. So using that with some therapy, through which you can figure out what is causing my anxiety, where is it coming from. Both of those things together can really help with anxiety.
Now, I've got so much anxiety that's not working. That's leading to depression, not me, but hypothetically. I'm anxious, I have issues. What about depression?
Yes.
Does this work better than other treatments?
So yes, so this is really exciting. Depression, this medication, so both ketamine and Spravato, ketamine having been around for a long time, and Spravato being a subtype of ketamine that has patent protection and sort of FDA approval for treating depression, and also specifically for anyone who might have thoughts of not wanting to live or thoughts of wanting to end their life. This treatment is actually one of the only 3 medications in psychiatry that has been shown to have really good evidence for treating that, and I've seen it work in real life. So this treatment really works well for depression, especially severe depression for folks, especially with thoughts of not wanting to live. And I can go through a little bit of the science of that, if that is something that you'd like. Yes. So a lot of antidepressant medications we now understand to work by increasing our brain's ability to be flexible. So remember I talked about being stuck in that hibernation phase? Medicines sort of make the brain more flexible so you can noodle out of that hibernation place easier, and that's how the medications help with depression. Classic antidepressants, we think, does this by a back door, sort of increases the flexibility of your brain by a back door. Ketamine and Spravato, or esketamine, does this in a more direct way, and it also has another mechanism that works together with that greater flexibility, and that is affecting something called the default mode network. Now, for people who are anxious, depressed, they'll tell you, oh, my mind just goes when I'm lying down for sleep. Or, if I have something to do or if I'm at work, I feel better because I'm not thinking about it. But as soon as I stop doing anything active, then all of these things come back. That's something really common I hear. That's because when we're not doing anything active with our brains, the parts that come on are what's called the default mode network. And for people with depression, anxiety, trauma, that network is pretty negative. It's full of negative self-thought, full of really big worries, and it keeps us stuck in that depressive and anxious place. And ketamine and Spravato, actually, and a lot of dissociative medicines, psychedelic medicines, it actually turns that network down so that these strong negative parts of the brain stop being able to talk to each other and get turned down. At the same time, we're getting more flexible. And that together, powered by therapy, can really help people move forward.
Wow.
It's really cool.
At night, it takes me an hour to get to sleep because I can't shut my brain off. Everything runs through it.
Yes.
And white noise does not work.
No.
I thought it would.
Yes. It's because your brain is full of these problems that it's trying to solve. And it's trying to solve them with our thoughts. And they might actually be problems with our emotions or problems that might live in our physical bodies. And it might not be the right way to solve a problem, but it keeps trying and trying and trying.
Well, ocean wave takes your mind off of it. The only problem is when you're old and you hear water running, you're making 100 trips you know where. So that defeats the whole purpose.
Yes, that does defeat the whole purpose.
Okay, now the part that really gets to me personally.
Yes.
I know a lot of people that are in the military that are veterans, and my heart has to go out for what they're going through. Unless you know what you see on TV doesn't even touch the tip of the iceberg. Someone with PTSD. I have a friend that we do events together. We were down the Cape doing an event, and he's near Bourne. They ended up doing a bombing simulation with the planes.
Oh my goodness.
All he hears is the plane coming in and a bomb go off after being dropped. He's under the picnic table.
Yes, absolutely.
I mean, instantly, he's not even thinking.
He's
as soon
thinking,
as he
I'm going
hears
to
that,
die.
He's under the table. The bomb goes off, the guy's shaking. My heart goes out to these people that they have to live like this. Getting back into PTSD.
Yes.
First, can you tell us what that stands for?
It's called post-traumatic stress disorder.
So it doesn't have to be just military, it could be a very stressful event.
Yes. There's different ways that we think of mental health conditions, and this is one way to think of how a profoundly difficult, frightening, life-threatening experience can lead to subsequent symptoms that can make doing what you need to do in life and living that safe and fulfilling life difficult.
Now, OCD, I can stop throwing initials around. Obsessive compulsive disorder. How can this help OCD?
OCD again, so that is probably underlying a lot of anxiety, but with specific ways that people again get stuck. This treatment, as well as other psychedelic medications, there's starting to be more evidence that, again, turning down that default mode network, as well as bringing on, these guided sort of exploratory therapies can help people sort of work through these areas of stuckness.
Now, I understand you also specialize in childhood issues that can be very difficult to treat. How's that work for you?
Yes. So I like to think about our brains as an organ, and we say, what's the job of the brain? I think the job of our brains are to figure out what resources there are in the world, what we need, what our bodies need, and what threats there are. So it's to optimize survival and also reproduction after figuring all of that out. So our brains from a very young age, even when we are still growing inside of our moms, start to build a sense of whether the world is one of plenty, whether the world is one of stress and fear and threat. And these really early experiences reinforcing, lack of emotional support from adults and parents, like care, all of these things can build up over a child's life, and that can have lifelong consequences. It can actually change the trajectory of your mental health and your physical health over your lifetime. And there's so much data around this now that we really are trying to figure out, how do we support parents better? How do we support our young children better so we can help folks as they grow up, rather than you're already sick and we're trying to help fix you.
Now, just so our viewers know, I don't know in advance what my guests are going to say. If I'm asking something, I have no idea what the answer is going to be, other than experience in the field. Now here's the million-dollar question I'm dying to find the answer to. You offer ketamine treatment. I'm like, is that white when I read it on the website? What is it, and is it a last resort after you've tried everything else? So if I walk in, you're going to give me ketamine for walking and say, hey, I'm depressed?
So when you come in, I do an hour evaluation. It's just like a normal appointment with the doctor. It's an hour long, and during that time, I go through what symptoms are you having that bring you in today, and how is it impacting the way that you're able to live your life. That's the first thing I find out. I also get a good, thorough psychiatric history for you and medical history for you. And that helps me do two things: to figure out if this treatment is going to be safe for you medically, because ketamine has some side effects, and is it going to be effective, because ketamine is good for some things, but not all things. So that's for me to figure out as I talk to you over the course of that hour. And if everything lines up, then we discuss what treatment is. And this treatment is something you get out as much as you put in. And I try to make sure people have the resources in place to optimize their chances of getting better.
Now, most people have never heard of ketamine treatment, including myself until about a month ago from you. What is the science behind the treatment? Because I never heard of it. How can it work? What's the science? Can you explain to us?
Yes. So, again, like we talked about, like how does ketamine work? How does Spravato work? How do normal antidepressants work? That's sort of where we'll go back to. So again, the science behind it is that there are these fundamental, sort of very strong parts of the brain that turn on in the default mode when we're not actively doing anything. That keeps people in depression. And our brains can take a small break from that. And at the same time, the ketamine, the Spravato, it goes to other neurons and it tells them, hey, we can grow, make new friends. And it tells them to make new thought pathways. And with the right support, with right intentions going into the treatment, you can use that to build more effective, more positive ways of thinking and being. And the more you strengthen that, the more you can sort of have those new circuits that grew with ketamine's help, balancing out those really strong, fearful, negative circuits. I like to tell people this. It's sort of like, I'm doing a lot of bike analogies today, but imagine you're riding a bike. It's a rusty bike. Mm-hmm. The depression is the rust. And you're doing all of this work. It's so hard to live with depression. But most of that work you're putting into pedaling this rusty bike is going against fighting that rust. Ketamine, all it is a little bit of oil to put on the rusty gears. You're still having to work really hard, even in the beginning. And because you're still having to pedal to get to where you need to go, but as you pedal more and more of the oil gets in, some of the rust flakes off, and it gets easier and easier to pedal to get to where you want in life.
I think your analogies are very important. Help people understand it. Now, for the viewers out there that do not have MD at the end of their name, could you please explain to the viewing public, what is the hindbrain circuit?
So I can give you a brief example or like a brief introduction. So the hindbrain is the oldest parts of our brain and the one that develops the earliest. So I talk about sort of different levels of the brain. There's the physical brain, which talks to our bodies and sort of tells our bodies what to do, but also listens to the body. There's our emotional brain, which has feelings, and then there's our thinking brain. So the hindbrain circuit is focused on our physical brain and our physical bodies. It's what makes our hearts race when we worry. It's what makes us sweat. It's what makes us stomach cramp when we're having sort of fearful emotions or worrisome thoughts. It's that connection to our bodies.
Now, is this treatment one and done, or is it multiple visits? Can I just walk in, hand you my copay, and load up on snacks, and an hour later I'll never see you again? Yeah. Do I need more than one visit?
Yeah. So remember how I told you this medication gives you as much as you put into it? It's sort of like that. It actually does require multiple visits. The sort of initial part of treatment I like to think of as the first 8 weeks. So the first 4 weeks you do twice weekly treatments of 2 hours, and then the next 4 weeks is a once weekly treatment of 2 hours. And then we see where you are. Did you respond? And how so? And do we have to change anything about the treatment? Is weekly working for you? Are you better enough that you can start to go, less frequently? And then we decide from there.
So there's no magic pill?
No. I say, to patients when they come into my clinic, I say, are you looking for a medicine that will just change your life and make you magically better? I wish I had that. I had that magic pill. But this medicine and all medicines work for people who are ready to make a change in their lives. This medicine especially so.
So basically what you're saying is you get out of it what you put into it?
Absolutely.
Okay. Now I understand that even one brief exposure to ketamine can have long-lasting antidepressive effects. Am I correct on this?
I will say yes and no. because there's a lot of information, there's science out there. So, ketamine works in a couple of different ways. That very fast, immediate effect, it does exist, and it exists more readily, or it's more readily seen in IV or IM. So ketamine that's given with a needle directly into your body. That effect, I find, is almost always limited to a few weeks, and then it goes away, even if you keep getting treatment. Because there's a short-term way that this medication works, and there's a longer-term way that this medication works, and that's sort of the part of ketamine that really has an effect for long-term depression, for long-term things like PTSD that remain to be resolved.
Now, earlier in the show, you mentioned Spravato. Mm-hmm. I didn't want to interrupt you. You're on a roll. Tell our viewers what Spravato treatment is, and how is it used for depression?
Yes. So Spravato is very similar to ketamine. Ketamine we've known for a long time. It was made right here in America in a chemical lab when they were looking for new anesthetic agents. It was approved in 1970. It was used extensively actually as a combat anesthetic.
Nice.
And acute pain reliever in Vietnam. It was used a lot. We've known it for a long time. It's part of anesthesia when we're thinking about surgery for pregnant women or even newborn infants. So it's, in terms of like medical safety, it's something that we have a lot of comfort with. But because we've known it for a long time, it's a generic medication. And for the FDA to approve any medication for a specific illness, people have to do all of these big studies to say, actually, this drug works, it's safe, and it's effective to treat it for this new thing. And that takes a long time, and it is incredibly expensive. So it's very difficult to do that extensive long-term study for a medicine that's already generic. So what Janssen & Janssen did was they were very clever about it. There's two types of ketamine. There's a right-handed type and a left-handed type, and half of those each other mixed together is ketamine. They took the left-handed type because it binds closer to the brain than the right-handed type, and they put that in a nasal spray, and that's what Spravato is. So it's very similar.
This is where you have MD name it. Okay. Before I see results, how long does it take before I start noticing a feeling that something's different that's actually helping me?
Yes. So this is where that short-term and long-term come in. So Spravato, and more often with ketamine, some folks feel this more immediate sense of, I feel great, I feel good, I'm not getting stuck as much in my daily thoughts, and I'm having like very intense, like meaningful and sort of, worldview changing sort of treatments. In our experience in our clinic, that doesn't last for a long time. It lasts a few weeks and then goes away. And then most people, especially with Spravato, it takes about 4 weeks to be able to tell, I think it's working. And then 6 to 8 weeks to feel like, oh, I don't know what's changed, but I feel better. It's the things that used to get to me don't get to me as much, and I feel like I can just do things. And so it's that natural cycle of our bodies. Like it takes like 6 weeks for our bones to heal. I think it takes about 6 to 8 weeks for our brains to grow new ways of being. And so I can sort of say, if this is gonna work for you, by 6 to 8 weeks, you should definitely know. We should start having an idea about 2 to 4 weeks in.
Let's talk about treatment.
Yes.
Is this like a day facility? I go in like I would my doctor, get treated, or am I there overnight, camping out, sleeping there? Well, a lot of different facilities have different things, so that's why I want to bring it up. I have some centers, you're there for a month, you're there for a week, you're overnight, you're living there. And I have others that's like a doctor's office. You go in, you get your treatment, you make your next appointment. Yes. What is it with you?
Yes, it's that, it's a day clinic, standard outpatient clinic. You go in, you get treatment, you go back, and you sleep in your own bed. You can do work. We have to make some slight adjustments around work, and it really depends how treatment affects you for the rest of the day.
I know there's no such thing as average. It's going to put you on the spot, but roughly a range.
Yes.
If I walk in, how long is the actual treatment? From the time I walk in, register, and leave the door?
Yes, it's about 2 hours. One of the things that makes ketamine safe as a medicine is it's in and out of our bodies very quickly.
Yes.
So the active phase of ketamine is, on average about 40 minutes, but it can be down as little as 20 up to an hour, and then it's functionally out of our bodies 7 to 10 hours later. So by the next morning, you shouldn't really have side effects lingering, ready to get back to your day. But when you're in the clinic, that's about 2 hours from check-in to check-out.
Nice. And it's the same at all your facilities, right?
Yes, and that's the same for Spravato everywhere, for ketamine everywhere. That is the standard, and that's what's mandated.
I'm not going to make you repeat it again, but we already talked about the locations of your facilities.
Yeah.
Is the treatment the same for everyone, or is it custom to each person?
So that initial phase of 8 weeks, when I said it's twice a week for 4 weeks, and then once a week for 4 weeks for the Spravato, is the same for everyone. Ketamine, it's twice a week for 6 to 10 treatments, so that's 3 to 5 weeks, and then you go down to monthly. That after that initial point, we see how you're doing, and we work with you to figure out how often and how long.
And how's the environment in the rooms?
So I remember
the
the treatment. Yes, the treatment rooms. So it's really lovely. We try to make it comforting and safe as much as we can. We try to give you as much control we can. I want to point out the noise-canceling headphones because music and the emotions that they bring out, the memories that it bring out, are really important as well. So it's a really lovely space where you have a lot of control, and the idea is to give you a sense of safety and control.
I'm definitely going to visit.
We would love to have you come visit.
Where do you put the snack room again?
Right at the front. You just walk in the door and there's the bar.
I'll come and visit.
Yes.
All right. Is the treatment going to say ketamine? Oh, I've heard things about it. Is this safe, especially under controlled conditions?
Absolutely. So part of that 1 hour intake I do is going through your medical history to make sure that it's absolutely safe. But like I said, we've been using this medicine for a long time. And the dose we use for depression is about half to a tenth what we use for surgery. And so that's the ideal dose. You can't give too much of it and still get as much of the antidepressant effect. So we want to do smaller doses, but ketamine we feel very comfortable with. Pregnant women, babies can even get it.
How long does it take me to get accepted as a patient? Can I just pick up the phone, just walk in?
You pick up the phone, there's some forms we have you fill out to sort of get the process rolling that then I complete at that 1 hour intake with me. And I see many patients as frequently as I can. And so some people can call in, fill out their forms, and they can get seen, the next day even. And then if everything works out, and we have availability, you have availability to come in and start that twice a week treatment for 4 weeks and then once a week. Some people can get started as soon as within a week.
And how do you get paid? Do you take insurance, Mass Health, or do I have to pay cash? And that's my credit card out.
Absolutely. So Lumin, the fundamental thing about Lumin is we want to make it as accessible for everyone, and so we operate mostly through insurance. And I'd say 99% of patients I see come and use insurance for the Spravato treatment.
Now, one last question. What days are you open and what are the hours? You around on weekends? Do some people do work?
Yeah, so we are open Monday through Friday from 8 to 6, except Tuesdays we're open 10 to 8, and that's starting next week. We're hoping over time that we're going to have more evening hours because it's easier for people to come in after work and do the treatment. So stay tuned, and we don't have weekend hours yet. We'll see.
Nice. Now, here's your close-up.
Okay.
Do you have any final words you'd like to share with our viewers? Don't worry about messing up. Don't worry about the 7 words we can't see on TV.
Yeah.
Believe me, she'll edit you right out.
Okay. I keep hitting that mic. My main message is it's so easy to suffer alone, but you don't need to. There are so many people who care. There are so many people who you don't know, who care about you, who love you. We would love to have you come in and for us to help you rather than you suffer alone. So please reach out, whether that's us or your nearest psychiatric urgent care. Massachusetts, there's one in every sort of town and locale. So please, please, please reach out for yourself or a loved one if you find yourself struggling.
That's awesome. I definitely got to get more doctors on my show. Okay, and thank you very much for appearing today.
Oh my goodness.
You're an
Thank
absolutely
you.
awesome guest.
No, I am so thankful and honored to be here and to share
Again, thank
this
you.
treatment.
Again, I apologize right on TV. I had a medical issue. This woman has been waiting for months to get on the show, and I had like a 6-month absence. So I finally have her on. She is definitely worth the wait. If you're having problems, please give them a call. I mean, I've never been so impressed with treatment centers with what's available.
No.
And stick around before our closing. I'll tell you where you can get 100 of these are going to be given out, so stick around. Now I'd like to share with our viewers an important event that's coming up. On Sunday, May 31st, of course the year, if you're watching, is 2026, Lumin is putting on its 2nd annual Live Free Fun Run. This event starts at about 9 o'clock-ish, 9:30, and goes till 1 o'clock. It's a 2.5-mile walk race around beautiful Pond in Woburn. The starting point is at the Sturgis Street entrance. Not only is it a fun run, but it is an expo on substance. There are about 25 exhibitors. I will be one of them. That will be giving out information, literature, giveaways, freebies as to what treatments are available for either you, a loved one, a family member, or just a friend. So you do not have to run or walk to take part in the expo. And the expo itself is free. The best way to get information is Woburn's website, City of Woburn. Just Google in the search bar with the word Fun Run, Live Free Fun Run, and it'll come up with all the information. Again, that is Sunday, May 31st. The year, of course, is 2026. I will be giving out xylazine test strips. This is what you would use if you're a heroin user, an opioid user, and you want to make sure that your batch hasn't been tainted with fentanyl. About 8 out of 10 batches, unfortunately, nowadays are. Some of the other information I'll be giving out, both in English and in Spanish, is how to stay safe and test your supply. And for the first 50 people, I'll be giving out the CPR pocket masks. This would help you if you want to do CPR on somebody that you know, or even if you feel comfortable on a total stranger, there's a barrier between you and their mouth. Last year, I gave out over 500 of these. I'm intending on giving out 500 to 1,000 this year, along with about another 2,500 pieces of different literature. So, hope I'll see you there. Again, that's 9:30 to 1 o'clock. Show up about 9 o'clock, a little bit earlier, and it's something you'll enjoy. I had a good time doing it, met a lot of good people, including some guests that have been on the show. I would like to thank our guest, Dr. Sun Fletcher, for appearing today. As always, thank you for watching. Please share this program with your social media friends. If you or someone you know is suffering from a substance abuse disorder, you can contact the Massachusetts Substance Use Helpline, and that's 1-800-327-5050. They also handle gambling issues. If you are thinking about suicide, you can speak to a specialist at the new state number 988. If you are having a mental illness issue, you can contact the Massachusetts Behavioral Health Helpline, and and that's at 833-773-2445, and they were recently a guest on my show a couple of shows ago. You can also call NAMI, Central Middlesex, at 781-982-3318, another featured guest. This show can be seen on a rotating basis on Lumin Public Media stations and on demand at their website and on YouTube. As always, thank you to the staff of Lumin Public Media for making this presentation possible. Please enjoy our theme for closing, Rise Above the Noise by Fireheart. Through the credits are important contact information. So go all the way to the music's over. There's a lot of contact numbers you may want. And for America in Crisis, Breaking the Cycle of Addiction, my name is David Hunt, and we're back.
Rise above the noise in the air. The sound not heard is what we bear. The whispers that I hear behind my back are those who never lost a child, a friend, so they lack a sense of loss, a peace that's gone with no return. Above the noise is how we cope, above the noise is how we learn. The most important things in life I found comes deep within the heart, the purest sound of those who won the fight. Now they found a life that's true, a life so rich above the ground. We are people who care, listen to the sound. Rise above the noise in the air. The sound not heard is what we bear. We are people who care. Listen to the sound. Rise above the noise in the air. The sound not heard is what we bear.